Hello everyone, today I'm back again with another live session with the Institute of Health and Management. As you know, we have been trying to create various live sessions to provide valuable information to our international students, which can help them to choose the better study options in Australia. So during this live session, I would be covering the important program for which our students and our valuable clients have been waiting since long. We know that's the Nursing Career Advancement Program and the Outcome-Based Assessments, NCAP OBA. So during this live session, we would be discussing about this program and when would be the intakes available and what are the entry requirements and how you can get admission in this program. So today I have two important guests from IHM, and the one is Simon, who is the CEO of Institute of Health and Management, and we have Sinta, and she's Marketing and Sales Management. So I would like to start the session with an introduction from Sinta about the IHM.
Thank you, Naman. Thanks for the lovely introduction. Good evening, everyone. I hope that you've been eagerly waiting to have more information about the new registration process in Australia. And as you all know, Institute of Health and Management have been pioneering in bridging program and nursing registration assistance to students for the last 10 to 13 years. To give a brief introduction about our college, Institute of Health and Management is basically a higher education provider. We are accredited to TEXA. So far we have assisted more than 1,500 nurses in their registration process in Australia. So with our expertise in bridging program and also in the new nursing career advancement program, we can proudly assist a lot of prospective nurses who are out there in India or various other places who are looking for registration in Australia in the coming months. So Simon will be going through his slides about the new registration process in Australia, and also we will be happy to share more information about the courses that will help any international qualified nurses to get to your registration process. Over to you, Simon.
Great, thanks, Sinta. Excuse me, thank you, Sinta. Okay, so what I'm going to do is I'll just share my screen with you now, so bear with me just a moment. There, and oops. Okay, so that I'll try again. Bear with me just a moment whilst I share my screen. This is not as okay. Bear with me. Sorry, guys. Just let me keep trying to do this for you. So when I hit share screen, it gives me lots of information, but not the right information. Works best on a good computer. I know that. Let's just share audio, follow these steps to share video, share my screen. So I share my screen. Okay, how are we going to work around this, I wonder? Okay, Sinta, are you able to possibly share your screen? I'm not sure whether you'll have more success than I will, because I'm not having very much success at all in trying to share my screen. Why don't you try and do that? See if you yes, I've got the share. I've got share my screen. I've got screen sharing works best on good computer. We've got that. Some screens will let you share audio. No, we know that. I hit my share screen.
Simon, I will try it from my end.
Yeah, so you try from your end and see what happens. So while Sinta's trying to get that screen up for you, let me give you a little bit of information about what we're going to be talking about today. So we're going to really talk about three things primarily. The first thing is about changes that are occurring in the nursing registration process in Australia. So for any nurse or any nurse who's looking to come to Australia to seek registration, first of all, and secondly, then to become registered and work in Australia, then you are going to need to be completing a pre-registration preparation programs to then go and do the registration process, which I'll explain in a moment. And then you'll be able to go on to registration and then into work and hopefully a long and successful career in Australia as well. So there's two new components, which we'll talk about in just a moment. The first thing that we should talk about is, why would you want to come and work as a nurse in Australia in the first place? And the reason is because, number one, the demand for nurses in Australia is very, very strong. There's a couple of components to that. Number one, obviously, is the COVID, the situation that's occurred around COVID and the focus that has put on the healthcare system as a whole. And it's really shown up in Australia as well as in a lot of other countries around the world, the strong demand for nurses, as particularly for specialist nurses. So nurses who have experience in ICU, critical care, accident emergency, etc., but also nurses who are prepared to work to study and work further towards becoming experienced in those areas. That's the first thing. The second thing is that in Australia, like most other countries around the world, the population's getting older. And so the older people get, the more care they need, the more nurses and hospital services and healthcare services that are required as well. So when you add those two things together, you then have a very, very strong need for nurses to be available from around the world. Now, it's particularly important at the moment that the nurses are needed both in metropolitan areas, so Melbourne, Sydney, Perth, the major cities. They're also needed, in locations around the world. In locations around Australia, in the regional areas. And the regional areas are anywhere from 1 or 2 hours outside Melbourne, right through to out in the remote areas of Melbourne, of Australia, where they might be 15, 20 hours away from Melbourne, Sydney or Perth. So there's a couple of those different options as well, both in the regional areas as well as in the metropolitan areas. Now, if you guys can bear with me just for 10 seconds, I'm just going to share my presentation with the guys at Aussizz, and then they'll be able to get that up for you. And if you can bear with me, you can probably hear my dog going absolutely crazy in the background. So bear with us for just a moment whilst we get ourselves organized and my dog calms himself down a little bit as well. Where are we now? So we go there, we go there, we go there, and we then go to bear with me. Bear with me. Sorry, guys. Just trying to find where I put this. Okie doke, maybe it's in here. There we go. Okay. All right, Sinta, that is now just coming across to you on Teams, and then if you can access that, that'd be great. Okay, so let's continue. Let me continue talking. So when you're looking at working in Australia, you need to think about a couple of different things. Number one is there's as with any city, there's a large number of hospitals in the metropolitan area. So Melbourne, Sydney, Perth, Brisbane, Adelaide, Darwin, Tasmania, in Hobart. There's also Australia has what's called a very strong distributed healthcare system, which works out through healthcare centres, super clinics, GP clinics, regional hospitals, base hospitals all over the country. So when you are thinking about work and looking for work in Australia, once you have finalised your registration, do make sure that you're thinking both metropolitan areas, so the large hospitals, as much as you are in the regional areas as well. Now there is some, and the guys at Aussizz would be able to give you some more information about the various visa and working options that are available for nurses who want to or are able to go and work in regional areas, because there is some very favourable visas available with some good long-term opportunities if you're prepared and willing to go and work in those areas as well. Okay, so when you're looking at them, think about both of those options for you. So as I said, the demand for nursing is somewhere around, in addition to, it's somewhere around 30,000 additional jobs per year over the next 10 years are going to be needed in Australia. So that's in addition to all the nurses who are being trained in universities and coming through universities, because the average age of a nurse in Australia is 57 years of age. The retirement age is 65. So over the next 10 years, there's a large number of nurses in Australia are going to leave the workforce, which is great for them because they're going to go and enjoy the retirement they've worked so hard for. But it also means that we now need to continue to provide or be able to train nurses to fill those roles. And that's where internationally trained nurses come into place, because internationally trained nurses, you guys are the difference between a decreasing number of nurses in the workforce and an increasing demand for healthcare as well, okay? So consequently, you guys then fill that void and you bring your fantastic skills that you have learned in your home country as well as the places that you've been working around the world as well. Now, registration in Australia used to be, you've probably heard of the bridging course or the iron course it was previously known. So in Australia, when you were wanting to finalise your registration as a nurse, you applied to the Nursing Registration Board and they then gave you had to look at three things from you. Number one is your registration certificate. And that's normally in your home country or the country where you're currently working. The second thing they look at is your qualification. And to qualify as a nurse, to be qualified to be registered in Australia, you need to have a bachelor qualification. So that's a level 7 qualification. Okay. If you're a GNM, so if you're from India and you're a GNM, you will have done a 3-year diploma. Unfortunately, that doesn't meet on its own the minimum requirement for registration in Australia. Now, let me explain why. The diploma course, the GNM qualification, is a 3-year diploma, which is a level 6 on the Australian qualifications framework. Bachelor is level 7 on the Australian qualifications framework. So you need to be, whether it doesn't matter, a nurse needs to be at level 7 or above in order to meet the eligibility requirements for registration in Australia. So if you're a GNM, you need to do a little bit of further study. And you can do that with us in a 1-year graduate diploma, which is the first year of a master's program. And that's a level 8 qualification. So you're able to jump over level 7 and go straight from level 6 to level 8. And the nursing board will recognise that, and then they will consider your qualifications meet the minimum standards. The third thing you need to provide is a language certificate. And you need to be at IELTS 7 or in all 4 bands. So that's IELTS 7, OETB, or PTE 65. And that's academic PTE 65. Okay, so any one of those 3, IELTS 7 in all 4 bands, OETB, or PTE 65. And they're the 3 things that the Nursing Registration Board will look at when they're assessing whether you meet the minimum requirements to then proceed through the registration process in Australia. Now, because your qualification, you'll have a bachelor or you'll have your diploma qualification. Because that has been studied overseas, 9 times out of 10, an overseas trained nurse will then need to go through the pre-registration assessment process. And this, as I said, used to be called the bridging course or IRON when it was a number of years ago. So the new bridging course is called EPIQ, Entry Program for Internationally Qualified Registered Nurses. And that's a 12-week, 3-month course that is done in Australia on campus. You can study that with IHM. You can study that with a couple of different universities. If you have that you can enroll in that course if you have already received your decision letter. And the decision letter is given to you by the Nursing Registration Board in Australia following their review of your 3 qualifications, as you remember. And here we have some PowerPoints as well, so we'll get to those in just a sec. So once the Nursing Board has taken a look at your 3 qualifications, your 3 requirements, remember your academic qualification, so bachelor or above, your language certificate, so IELTS 7, PTE 65 or OETB, and also your registration, then they will then determine that yes, you meet the minimum requirements, but because your qualification is from overseas, you need to go through the registration process. I'm going to ask the guys if you could skip down to slide number 7, that'd be great. Oh, thank you, Sinta. Excellent. So these are the 5 steps of the new nursing registration program. The new nursing registration program is called OBA, which is Outcomes-Based Assessment. Now, what that means is instead of you coming to Australia and doing a 12-week course, 6 weeks in the classroom and 6 weeks working in hospitals, what the Nursing Board now wants to do is they want to assess you in 2 different ways. And those 2 together, you've passed the first one, you then finish the second one, and then you'll be moving on to registration. So it sounds a whole lot easier, but it's really a lot more about assessing your skills and demonstrating your skills and your knowledge of the Australian nursing and healthcare system, and then how you apply those to provide care to nurses or to patients. So as I mentioned to you, there's 5 steps. The first step, step number 1, is what's called a self-check. And this is where you will simply go to the AHPRA website and you will set up an account, and they'll send you a username and a password. And this is a simple self-check, and they will ask you, what is your minimum level of qualification? What is your language level? Where are you registered? And they will then tell you through that self-check that you are eligible to be registered, or you're not eligible because you may be a GNM, you may have done a 3-year diploma, and you now need to do some additional education in order to meet the minimum eligibility. So the self-check you do through the AHPRA website at no cost. So you simply do that. That is your first point of contact. Once you've done your self-check and you've established that, yes, I'm eligible to then go and register, you can then move on to step number 2, where you can formally apply for registration. And again, you do that online and you fill in an application form. You provide your registration certificate, your qualifications, your language certificate, your work history, etc., and any other short courses or information about short courses, qualifications you might have done. You might have done a 5-day workshop on ICU, so you would provide that in that as well. Okay, you pay 640 Australian dollars, and AHPRA then takes somewhere between 4 weeks and 6 weeks to do an assessment of a formal assessment of your application package. Now, they will then determine whether you are eligible or not eligible. If you're eligible to be registered, they will then send you what's called a decision letter, or a DL. So most nurses who have thought about Australia know all about decision letters. There's one thing I'll say about nurses: you know a lot about how to work in different parts of the world. So in Australia, the DL is the letter that you're after most. And that decision letter normally will say that you are eligible for registration, but you need to do the OBA preparation because your qualification isn't exactly the same as a bachelor qualification in Australia. Okay, so you get your DL, which is great. So that's fantastic. Pat yourself on the back. Well done. You're climbed the second peak of the mountain. Then we move on to step number 3. And step number 3 is a simple online orientation training course. And it's just to start to give you some information and help you learn about Australia and the Australian healthcare system, how nursing is provided, where nurses fit in, how the healthcare system works. And your answers and participation in that orientation, which you must do, it's an essential part of the process, and that's why it is a standalone step number 3. That will then, you will then finish that, and then you will be able to progress on to take the NCLEX online MCQ, which is the multiple choice question test. You must do the orientation, and it'll ask you questions based on what you've just been learning, and you'll do some little assessments and you'll progress your way through the orientation, okay? Once you've passed the orientation, you'll then be sent an email and invited to book your next time to go and do the NCLEX MCQ test. Now, this is an online test, and for those of you who have maybe looked at working in the US or Canada, you might have already done an NCLEX test previously. Now, the one in Australia will be different to the one that they use in the US. So if you've done an NCLEX test in the US, or you've done preparation, or you've passed the test, you'll still need to do NCLEX RN for Australia, okay? So they're not looking, you can't do it once and it applies around the world, because the Australian one is a little bit different. So this is, for those of you who have done it, please bear with me. For those of you who haven't, NCLEX it's an online, what they call a cognitive test. So what it's trying to do is it's testing your understanding of nursing in Australia, okay? And you do this test wherever you're working or living at a PTE testing center. So this is all done through Pearson. You book it through Pearson, you pay what is about 550 Australian dollars, and you then go to the Pearson Testing Centre to do this test, okay? So again, you can simply Google NCLEX and you'll find lots and lots of information about NCLEX, about how the test works, etc., okay? But one thing you'll see, all very common, you must prepare for the NCLEX test, okay? It's a tough test. It's not meant to be easy, but if you prepare, it's like any test, you'll do well as well, okay? So once you've done the NCLEX test, and that takes you a part of your day. It's only a few hours at the Pearson Testing Centre, wherever you're living, in India, Dubai, London, wherever you may be, okay? Once you've passed that test, and you'll know within 24 hours, you'll get an email saying you've passed or you've failed. If you failed, you can resit the test. I think it's up to 3 times you can resit the test. But you will need to do preparation, because they're not going to tell you the areas that you did not do well in or you failed in. They're just going to say you failed and you need to take the test again, okay? If you pass the test, you'll then be sent an email within 24 hours inviting you to then book your OSCE one-day assessment at Adelaide in Australia, okay? Now, OSCE is basically simulation testing over one day to test your knowledge and your practice of nursing skill with a patient. Now, this is being done in Adelaide in South Australia. So for those of you who know Australia, Adelaide is on the bottom, is down the bottom on the southern part, between Melbourne on one side and Perth on the other, okay? So it's wedged between 2 of the best cities in the world, isn't it, Sinta, as well. So this is a one-day assessment at the Adelaide Health Simulation Centre. And what you'll do 2 different things, okay? You will do, if we can just go back, that's great. You'll do 2 different things. Number 1 is you will do 4 simulations. And these will be with an AHPRA assessor. You'll be given a simulation that you'll read 5 minutes or 3 minutes before you walk into the testing room, and there will be a live patient in that room, okay? And what you then need, you have about 15 minutes then to explain how and go through the process of providing care to that patient, okay? The AHPRA assessor will take some notes, she'll ask you some questions, and you'll then get to explain and show your great skills and technique, okay? The OSCE assessment is $4,000 per time, okay? So if you do not prepare and you decide, I'm just going to go and have a try, that will cost you 4,000 Australian dollars. And then each time you go back, and I think it'll be up to 3 times again, you will pay another 4,000 Australian dollars, okay? So preparation is really, really important, and that's what we're going to talk about now. So that's the new registration process, okay? So to help you prepare for this new process, and as I said, preparation is really important. If I look at the OSCE system in the UK, about 45% of nurses who turn up, who go to OSCE, fail on the first attempt. Okay, some prepare, some don't, but still 45% fail. About 30% fail on the second attempt, and about 10% fail on the third attempt. Okay, so preparation is really, really essential. Okay, so as we said, 2 parts to the new process. One is the NCLEX test. The second is the face-to-face clinical exam, OSCE, in Adelaide as well. Next slide, thanks, Sinta. Thank you. Next one. You went backwards then forwards. Thank you. Great. So what we've done at IHM is we have developed a 2-part training program for nurses who who need to then go and take the OSCE or the new assessment process. Part 1 is preparation for NCLEX, and this is a 12-week course that we'll talk about in a moment. Part 2, part 1 you do anywhere in the world online. It's 12 weeks online, 2.5 hours face-to-face with our lecturers, 2 days, 2 times per week. Okay. And then you have then you've got self-directed study, there's assessments, and every day we will send you a bunch of NCLEX questions that you need to answer every single day over that 12 weeks. Okay. NCLEX is one of those tests, practice makes perfect, because they ask the same question in 4 different ways in 4 different parts of the test, and they want the same answer, not 4 different answers. Okay, so it's important that you understand you understand how to look for the question and what the question is asking, rather than simply looking for the pattern. Okay, the second part is in Australia, and this is 6 weeks in Australia at IHM's labs in Melbourne, Sydney, or Perth. It's essentially 5 days per week, 8 hours per day. Okay, morning in the lab, afternoon in the classroom, morning in the classroom, afternoon in the lab. Okay, so it's quite intensive, and it's all about OSCE preparation, going through the simulation in order to prepare you to be successful with the OSCE exam. Next slide, thanks, Sinta. Okay, so part number 1, as I said to you, is 12 weeks, 12-week online course. Orientation is the first week, and then you get straight into the 12 weeks, okay? We cover 3 units. The first unit is about the MCQ exam, how it works, how to answer the questions, how the questions flow, etc. And this is being taught to you by nurses who have done NCLEX exams. It's not just somebody who's read a book. These are people who have actually done the NCLEX exams, okay? We then teach you 2 additional units, and the reason we do this is because it's one thing to think you know how to answer the question. It's another thing to know the knowledge, to have the knowledge to be able to answer the question. So we teach you 2 additional units, nursing care in Australia and nursing in the healthcare system in Australia, okay? These are the areas that will be covered in the NCLEX exam. If you remember back to the orientation, when the orientation unit you do once you've got your decision letter, the same areas are covered again. What is nursing in Australia? How does the healthcare system work? What do nurses do? What do doctors do? Interdisciplinary medical teams, etc., etc. Okay. Then we'll teach you skills, and big skills, and then because the MCQ test is asking you to basically say correct or not correct, true or false. Is this the right way to provide care? Okay, and that's what we'll teach you how to do this. The only admission requirement is that you must be currently registered as a nurse in your home country. Okay, so you've got to hold current registration, which you will have done if you've applied for your DL. You'll have that already. The course cost $3,500 for the 12-week online course. Okay. Now, the course includes, obviously, all lectures and tutorials. It includes resources. It includes more. Every day, there'll be a daily bunch of questions sent to you that you need to answer and then send back. And then the next day you'll get another bunch and another bunch and another bunch. So by the time you've finished the 12 weeks, you will have been through a whole series of questions that make up NCLEX exams. Next slide, thanks, Sinta. Part 2, once you've passed the NCLEX exam, part 2 is then the OSCE, preparation for the OSCE assessment. Now, as I said, 1 day in Adelaide is the OSCE assessment, and that'll be a full day for you as well. In preparation for that, the OSCE part 2 is 6 weeks on our campuses in Melbourne, Sydney and Perth. There's only one unit, and that's OSCE training and assessment, okay? This is all about practice. This is all about practicing all of the skills that you have from India, Dubai, Saudi, London, New York, wherever it may be, and now putting those into the way it's done in Australia, the Australian nursing standards, okay? It's how to deliver care to the Australian nursing standards, the nursing code of conduct, the legislation around healthcare provision, and all of the other legislation and laws that exist around healthcare in Australia. The cost of the 6 weeks is $5,500. Okay, so a very, very reasonable cost for what will be 40 hours per week, 5 days per week. You do get weekends off, but if you feel you need more practice, you're more than welcome to come and use our labs on the weekend, and we'll have somebody on hand who can then take you through some additional practice and some additional simulation. Okay, so this is it's intensive, because this will teach you how to pass and how to be successful in the OSCE exam. Okay, so 2 components: part 1 online, part 2 in Australia. Okay. Next slide, Sinta. So let me give you a little bit of information about why choose IHM. Now, the Institute of Health and Management, we focus in nursing and healthcare. So we are a specialist in nursing and healthcare. All of our lecturers, all of our tutors, all of our support staff are nurses. Okay, they'll either be PhDs, they'll be masters, they'll be bachelor holders, depending on what the role that they're filling, okay? The people who are teaching you NCLEX MCQ have done the test. They've passed the NCLEX test, which is even better. But they understand how the test works, they understand how the questions work, etc. Okay? So all of our staff are experienced. They're all nursing professionals. Because the first part of NCAP is online, we have what we think is probably one of the best online learning platforms in the world. And that means that when you're studying anywhere in the world, you'll then feel like you're in a classroom. Your lecturers will be working with you as though you were sitting in a classroom with them as well. You'll do breakout sessions and small group discussions. You'll come back together as a class and discuss the findings, and then you'll go and do a little bit more group work, and then you'll go and do some background reading and resources, etc. Okay. When you come to Australia, our nursing labs are, I think the Nursing Board has recognised our labs as among the best in the country, best in Australia. So they're as good as working in any hospital. The equipment you will find in there and you'll practice on is the same as you will find in any hospital in Australia. Okay. The fourth and probably most important point is that you guys all work. You work, you've got family, you've got things to do. And when we look at when students contact us for student support, it's often at 10 o'clock at night, 11 o'clock at night, 5 a.m. in the morning, because I'm about to start a shift, I've just finished work. So our student support is available 24 hours a day, 7 days per week, at the times when you need support, not when it's convenient for us to be open. Okay, so 24/7 support. If you've got a question, you can contact student support and they'll be able to give you an answer. You want to lodge an assignment, you can get online and student support will help you do that as well. Okay, so four pretty important points. IHM, as I said, we specialize in nursing. Over the past 18 months, we've trained 1,500 nurses through the EPIQ RN test program. So they've done that 12-week course. Just on 1,500 nurses are now out in the workforce. Okay, and there's more nurses every single month. For those who have a decision letter for EPIQ, there are seats available right through to, we have approval right through to August 2021. So for anybody who may have a decision letter to go to EPIQ, then please contact us and we'll be able to fit you into an upcoming intake for EPIQ. When do the NCAP courses run? The next one will be starting in the beginning of October, and every 6 weeks we will be having another intake for NCAP, NCLEX, MCQ. Okay. We will then be starting later in the year, probably around November, we'll be starting the NCAP OSCE, which is on campus. We're just waiting, we're putting it to November at the moment because with coronavirus restrictions in Australia, it's not always easy to get people into nursing labs and into campus, but we're hoping by November things will have settled a little and we'll be able to then do that as well. Okay. So hopefully that's given you a little bit of information about the nursing registration process and what those changes, which are significant changes, but also I think makes the system, the process, a lot easier for you to demonstrate the great skills that you have. Okay. Quite often people go from their school, they do exams, and then they come into sit in a classroom, and it's a very big difference between working and coming back into a classroom as well. So we think the OBA process is actually a great way for nurses to demonstrate the skills that you have been learning whilst you've been working. Okay. So we've talked about the NCAP preparation, part 1 and part 2, and we've broken it into 2 parts because there often will be a break between you doing the NCLEX test and when you're then wanting to start to sign up for your OSCE assessment. Okay. And that could be for a whole range of reasons. So we've broken it into 2 parts to make it nice and easy for you to get started and then come to Australia and do the OSCE preparation as well. Okay. So if you have any questions, now would be a great time. We're more than happy to answer any questions about the process. If you are a GNM nurse, you should be aware that, as I said earlier, as a GNM nurse, so you've done the 3-year diploma, you won't be eligible for registration in Australia because your highest level of qualification is level 6. Okay. You need to be level 7 or above. So you would need to go and do a graduate diploma in nursing. That's a 1-year course. It's the first year of a 2-year master's program. And at the end of that, you will graduate from IHM with a level 8 qualification. And you then submit that to the nursing board, and the nursing board will say, tick, fantastic, welcome aboard. And then that will mean you meet the qualification benchmark for registration in Australia. We have a large number of nurses from overseas who are doing graduate diploma, and then they apply to the Nursing Registration Board and continue on their registration journey as well. Okay, so that's what we had to talk to you today about. If there are any questions, we're available now to answer questions and fire away, but thank you for your time.
Thank you, Simon. It was really very informative. So we have few options in the comment section. So I would be reading one by one. So the first question is from Ramandeep Kaur, and you have covered this part, still want to read this question. It's a diploma in nursing from India, and here which course should I start to become a nurse or get registration in PR? Okay. What startup would be the best? Please reply. Yeah.
Okay, Ramandeep, good question. So diploma in nursing, the next course you need to do, you have 2 choices, but the best course for you is a graduate diploma in nursing. And that's a 1-year course that's offered by IHM at our campus in Melbourne, Sydney, or Perth. That's 1 year on campus. Now you can do that in Australia on campus, or you can do that online. Both, it's the same course, 1 year online or on campus. Okay. Now here's a couple of things to think about, Ramandeep, as well. If you are wanting to become registered and then live and work in Australia, you may also want to consider completing a 2-year master's program. The first year is the graduate diploma. The second year is the master's course. With that 2-year master's, you will then be eligible for a post-study work visa. Now, if you study that in Melbourne or Sydney, that's a 2-year post-study work visa, which means you can live and work in Australia full-time for another 2 years. If you study that in Perth, the 2-year master's in Perth, you're then eligible for a 3-year post-study work visa, which means you live and work in Perth, full-time work, as though you are, you're a nurse working in Australia. Now that gives you time to finalize your registration, get into the workforce, and then if you decide to, you might also want to apply for permanent residency. So there's 2 steps in there, Ramandeep. The first step is graduate diploma in nursing, online or on campus, and that means you will then meet the eligibility requirements from the nursing board to register. The next step for you could be, instead of just the 1-year course, the 2-year master's course instead, in which case then you'll be eligible for the post-study work visa, which is then 2 years or 3 years if you study in Perth. So that's the way to get started. Whilst you're studying your graduate diploma and then going on to your master's, you can then apply for registration and finalize your registration whilst you're living and working in Australia. If you do that online, you simply do the NCLEX online, and then you come to Australia to finalize your registration, and then continue on campus in Australia to finalize your master's and then your post-study work visa. Okay. Now, the guys at Aussizz will be able to map all that out for you, because I've just given you a whole lot of information, which I know sounds probably like a whole lot of gobbledygook. So speak to the guys at Aussizz and they can map that out for you as well. But that's the best way to get started.
Okay, thanks, Simon. So I guess, Raman, you have got a brief idea, but would be the next pathway for you to get registration as a nurse in Australia. So if you're looking for further information, you can see all the details in the Dropbox. So you can contact us, you can send us email, and we will be getting back to you as early as possible. Moving to next question, it's from Shivjot and wants to know what are the options which are available now to get registration in Australia. I guess the whole session is about this only. Still, if Simon want to answer this question.
Sure. So look, Shiv, you've asked a very broad question. Okay. Yeah. So what I'm going to do is I'm going to assume that you are eligible for registration already. So that means you have a bachelor qualification. Okay. So if you have a bachelor, you are eligible to apply to AHPRA via the website for registration. Okay. 2 tips. Number 1 is do the self-assessment, because then you can fill in the boxes, tell AHPRA what you have, who you are, where you've been, and they will then confirm for you before you then go and lodge your application. Because each time you lodge an application, it's $640. Okay. So once you're eligible and you've got a decision letter, the process is very simple. 2 parts to the registration. First part is the NCLEX test. The second part is the OBA assessment in Australia in Adelaide. First thing, you should prepare for both. Okay, they're difficult. You will know if you've been trained and live and work if you've been trained in India, you've been trained in in Nepal, you've been trained wherever, you will know the nursing standards for India, for example. They're very different to the nursing standards in Australia. Okay, so what we do in our preparation through the NCAP Part 1 and NCAP Part 2 is we take your existing knowledge and then translate that into Australian nursing standards. Sometimes you need to learn more, other times it's pretty similar, and that then prepares you to go for those 2 tests. Okay, so very simple, Shiv. 2 parts, apply for registration. Part 1, online NCLEX test. Do the NCAP test, do the NCAP preparation 12 weeks online. Part 2, OSCE test, 1 day in Adelaide, do the preparation in Australia, 6 weeks on campus, and that will be intensively prepare you to then do really well in that test, okay? If you don't have a bachelor, then as I said to Ramandeep earlier, you must do the graduate diploma, or you might consider doing a master's in order to then have the post-study, the stay-back option in Australia.
Okay, thanks, Simon. So moving to next question, we have from Preetaman. She's asking, will this OBA program requires PT score or we can do without PT? We have covered this. Yeah, still, Simon, you can answer this question.
All right, I'll just answer briefly. So Preet, if you are in order, there's two components to this. Now, let me just be clear. There's 3 steps to this process. One is your education. The second is registration. And the third is migration, if you're considering migration, okay? There is no shortcut between 1 and 3, okay? You can't go from education to migration and skip the whole registration thing, okay? Nurses need to be registered to practice in Australia, just the same as the INC, the Indian Nursing Council, does in India as well. You can't work as a nurse unless you have registration. Okay, so there's no shortcut between 1 and 3. You've got to go 1, 2, and then 3. All right. So language, PTE scores to be eligible when you apply for nursing registration. PTE 65. That's 65 academic. Okay. All 4 bands, no variations. PTE 65. Okay. Now you can do OBA before you go and finalize your PTE. And this is one thing that Sinta and I advise quite often, is when you get a language test language test you've got, and then it's valid for 2 years, okay? So, but there's no point doing a language test, then do NCLEX, and then wait 2 years, and then do another language test before you go and do OBA. Just do the language test once, okay? You can do the preparation course, the NCLEX preparation first. All you need is your registration, no need for PTE. Then apply for registration. Sorry, let me go back a step. Do the NCLEX preparation, then do your PTE test. And we offer also online PTE preparation to help you prepare to do your PTE test. Then do your PTE test, then apply for registration, then do your NCLEX test, and you've still then got 2 years on your PTE language certificate in order to finalize your registration. Okay, so there's no need to go and do the language test over and over and over again. Okay.
Simon, I would like to make a comment on Preet's question. So that's a really good question. A lot of students are really confused whether they need a PT score prior to they start their registration process. So good thing with the new IQNM processes, they don't need a PT until they complete all their process until OSCE. So to start self-check, they don't need a PT. To do their MCQ or their OSCE, they don't need a PT. If they have cleared the English score, that's well and good. Otherwise, they can prepare for the PT or the English test. Meanwhile, they prepare for their registration. And only after they submit their documents at the end, after they clear OSCE, at that time, only students need PT or they need to submit the document to AHPRA. So they can have all those time to prepare for the English test. That is an additional advantage of the new IQNM process.
It is, isn't it? So do it once and do it well instead of having to drag it in, because it is a hassle. It's a real hassle. English is tough. But this is one thing that I think, Sinta, you'd have to agree as well. That's 6 weeks in Australia, living and working in an English-speaking environment, your language will improve 400%. Just because you're living and working and practicing as a nurse in an English-speaking environment. On our campuses, we only speak English. It's an English-only environment. Outside the campus, guess what? It's an English-only environment as well. And to make it worse, it's Australian English, which is even worse. So, it is, but your language will improve a lot when you're with us for 6 weeks in Australia. Next question.
So if
you want to continue something, Sinta?
No.
That's all good.
I guess, Preet, Aman, your doubt about the PT test requirement is now clear. So moving to next question, it's from Jasmeet Kaur, and she wants to know what is the best book to prepare for NCLEX test.
What is the best book? Jasmeet, I would have to get back to you on what the book is. I mean, you could go to Google and there'll be 100 different choices, okay? The way we've designed our course, although there's texts, there's reading texts for you, books, it's designed so that you learn without having to just buy a book, okay? Because our experience is when you just buy a book is when nurses turn up to the test and they fail because they don't know the answers. They know what the books teach you is how to pick up the pattern, okay? Because it's Australia, there won't be a pattern, okay? What Australia is using this new system for is so we get the best nurses in the world to work in Australia, okay? So that's why when we do the NCLEX, when we do the NCLEX preparation, we teach you those 2 additional units, nursing in Australia and nursing practice. So we then teach you how to answer the question so you don't need to worry about the pattern, okay? You'll know the answers.
Jasmeet, just to add on what Simon has mentioned, so there are a lot of online resources available, but saying that, this is some feedback we have received from students who have taken NCLEX in Australia. So even though you practice questions, you will not get the same questions when you go for the test. So you may have to have in-depth knowledge on the different topics in nursing so that you can get questions that is similar, but you won't find any similar questions or exact questions which you will do in your online practice materials. So it's very important for you to have an in-depth knowledge on various nursing topics to be able to crack the NCLEX MCQ. So that's why we suggest you to enroll with IHM's NCLEX MCQ preparation program. That will be the best textbook for you to prepare for your exam.
Good luck, Jasmine.
Okay, moving to next question. It's from Daljit Kaur, and she wants to know, is there any other pathway for international nursing graduates that need to direct registration?
Daljit, the only other option is to do a Bachelor of Nursing. That's a 3-year Bachelor of Nursing course in Australia, okay? The course is only taught in Australia because you must do that course on ground in Australia, so then you can go and practice in Australian hospitals as well. That's the only other option. There's either a Bachelor of Nursing or a Master in Nursing. I think there's 1 or 2 courses, Sinta, that lead directly to registration as a Master's, but they must be done in Australia, and that's 3 years or 2 years. Let me give you an idea on cost. The Bachelor of Nursing course in Australia is anywhere between $75,000 and $90,000 Australian for the 3-year course. The Masters that leads directly to registration is somewhere between $50,000 and $65,000 for the 2 years. Okay. To give you an idea that if you are, Daljit, if you are a GNM, so you're a diploma holder, the graduate diploma in nursing through IHM is $20,000 on campus, $12,000 online, and the 2-year Masters program is $44,000 on campus in Australia. Okay, so our 2-year Masters, and we have made our Masters a little less than other providers' universities, and that's because we know that nurses work hard, but you also don't get paid $1 million a year. So we need to make it affordable for you, not $60,000 or $70,000. We'd rather see you have an opportunity to live and work in Australia for somewhere around $45,000. Okay.
Yes. And also, Simon, if Daljit is looking for a program which directly leads to registration, the biggest challenge student has is they have to first clear 7 each to be able to get into the program. So that is a real challenge, and that stops many students from getting into the process. Whereas if they are taking an option through IHM, through our graduate diploma, they only need 6 to get started. And also, if they are a bachelor's and if they want to get started with their OBA process from India, if they're considering OBA, they can start the registration process right away, even if they don't have an English score. So they are already in the board. But if they are considering a program, first challenge is to clear IELTS 7 each, then only they will be able to start. And also at this stage, due to COVID, borders are closed and students are unable to travel. So whatever they study, it will not count towards their Australian study requirements for stay-back. And also our master's program, GDN plus Master of Nursing, will be the most is the only, the most affordable master's program in Australia compared to other providers who offer masters. So definitely, that's how it distinguishes, our master's program distinguishes us from other providers in nursing.
Yeah. Hopefully that helps you out, Daljit.
Yeah. Okay. Moving to next question, it's from Dinah, and she wants to ask, I'm about to complete MSc Nursing in Psychiatry from Bangalore. Am I eligible to work or to research in Australia upon completion of my course?
So just let me, I'm about to complete MSc. Well done. Congratulations in psychiatry from Bangalore. My goodness. Am I eligible to work or research in Australia upon completion of my course? So there's a couple of pieces to your question. Let's talk about the registration piece first, and then we'll talk about the PhD component, which I presume would be why you would be doing the research to work towards your PhD. So the registration component, with holding a master's in nursing, you are eligible to apply for registration. I would say you've done a very smart thing. There's a very, very strong demand for master's qualified mental health nurses in Australia. Okay, and that demand is only getting bigger and bigger and greater. Melbourne metro regional areas as well. So yes, you are able to register with your master's in psychiatry from Bangalore. So complete that, and then you can start the registration process. You can even start the registration process now because you will already have a bachelor qualification. Okay, and then when you finish, but if you wait, if you apply now, get your registration process started, finish your MSc, and then you'll be able to then use that master's if you decide to then apply for permanent residency, because you earn an additional 5 points with a master's compared to a bachelor. Now let's talk about research. So in mental health, as I said, this is an area that has exploded in Australia, around the world as well. And there's a lot of research opportunities through universities. The reason you would do your research, because obviously out of your master's, you'll start with the mini thesis as your final piece, and then that will then be essentially your application to apply for a PhD. So you're able to, all Australian universities host PhD students. Generally, as I said, that mini PhD, you'll then need to apply to the different universities, put forward a proposal in an area that you wish to research, and the university will generally help you in developing that proposal if they then accept you into their program, and then you can work towards your PhD. You could also look at work in a research institute. So like the Doherty Institute or one of the health or medical institutes that is very heavily research focused as well. So there's a couple of options for you there. One is the academic path to a PhD through university, or the second is through industry, through a research foundation or a research institute, again into mental health. So there's a couple of options there for you. But the first thing you will need to do is to finalize your registration, because to work as a researcher, you still need to be registered as a nurse as well, as a practitioner in that area. That's one of the unique things about nursing and medical, is you need to be registered as a practitioner in Australia in order to then be part of a research program. Hopefully that helps.
Thanks, Iman, and I hope, Diana, you have got your answer. Moving to next question, it's again from Preet Aman, and she wants to ask, do AHPRA gives particular time period to clear the OBA?
Sinta, I heard 3 months or 3 months between NCLEX start and NCLEX. Is there minimum time between NCLEX finish and OBA?
Actually, AHPRA hasn't come up with any, number of attempts a nurse could take as of now. So the only thing is, if they have booked their test, they have to take the test within the next 90 days. But there is no confirmation about the number of attempts a student can take for NCLEX RN, which means they, as of now, they can take as many attempts they can. Yeah.
But the important point, as Sinta said, is once you receive that email from AHPRA to say you can now book your time, from the date you book your time, you only have 3 months or 90 days before you have to take that test.
Okay. That's right.
Okay, thanks, Simon. Now moving to next question. It's from Humayu Wajipur Durrani, and she wants to know: is the English language test required for UK registered nurse?
Short answer is yes. You need a minimum level of English in the UK. It's a little lower than Australia. I think it's IELTS 6, if I recall. But you do need, all health services around the world will require a minimum level of English, okay, in order to meet the registration standards. Okay, Sinta, I think, is just checking the UK standard right now.
Yes.
But in Australia, it's IELTS 7. In the UK, I think it's IELTS 6, if I recall. In Dubai, it's IELTS 6.6 to 6.5, for example. So different countries, different levels, but there's always a minimum level. Okay. Sinta will come back to you in just a second.
Yeah, definitely we'll come back to you. I don't want to comment on that without a proper clarification. But even GNM nurses, they can actually apply to UK for registration. Bachelor's is not a mandatory requirement, but I'm just checking.
Yeah. So what we might do, maybe we move on to the next question, and then Sinta by then will have Google will have produced a good answer.
Yeah. So moving to next question, it's from Anna Maharjan, and she's writing: I have done self-assessment. It tells about the upgrade of the study.
So Anna, you must have a GNM. You must be a GNM with a 3-year diploma, I would imagine.
Yeah, sorry to interrupt, Simon. She further wrote: I have done PCL nursing 3 years and bachelor in nursing 3 years in Nepal. Could you please tell me when I get registration or not?
Okay,
Right.
that was going to be my next comment too, Anna. You're either a 3-year diploma holder, or you've studied in Nepal. So PCL and bachelor in nursing are, and again, this is different countries. Let me just explain so that you understand. Australian bachelor course covers a whole range of different things in its course. And that's about the knowledge it teaches, the amount of time you spend in clinical placements, the amount of time you spend working with doctors and nurses and things like that in that course. Okay. What the nursing board then does is they look at the PCL course from Nepal, they look at the bachelor from Nepal, okay, and they then map the two against each other. Okay. And if your course in Nepal, for example, spends more time in the hospital, less time in the classroom, then they'll say that they're different. So you then need to do the bridging course, or you need to do OBA, or you need to do another qualification to bridge your skill. Okay. So, and what generally happens, Anna, is courses in Nepal, because Nepal trains for Nepal, it doesn't map very well to Australia. So consequently, you will need to do further education, and I would recommend you've done your PCL, you've done your bachelor, which is 6 years. You need to do 1 more year to go from your Nepalese bachelor to graduate diploma in nursing. Okay. So when you do the self-assessment, that's what the self-assessment's doing. It's saying yes or no. If the answer's no, then you need to do more education. It won't tell you what education to do, but you have 2 choices. You can either go and do a 3-year bachelor course in Australia, okay, which is kind of tough, or you can study and do the 1-year graduate diploma in nursing, which is the path that we would recommend for you, okay. Did you have anything else you wanted to add in there, Sinta?
Yes, actually, if Anna has got, if Anna has got the outcome as to upgrade her qualification, which means after her self-check, she has been assigned to stream C. So once a student completes a self-check, usually they get assigned to 3 streams. And there are some instances where students may not get assigned to any streams based on the institute they study. That doesn't mean they cannot clear. They still have an option. But after their portfolio assessment, in the second stage, regulatory officer will advise their pathway options. So for her, Anna, she has got stream C, but there will be students. If a student is progressing to OBA, they will be getting stream B after they complete the self-check. So mostly for OBA aspirants, they will get stream B after self-check. And if you have to upskill your qualification or upgrade, then you will be assigned stream C.
And Anna, just so you know, Stream A is then for qualifications from the UK, New Zealand, US, Canada, some South African universities, etc. So map across, and Chile of all places as well. So yeah, so if you're in Stream C, you need to upgrade. Graduate Diploma in Nursing will be the because if you go to the self-check, you'll see the Graduate Diploma in Nursing is one of the options that you can nominate when you are doing your self-assessment. So have a talk to us after the after this live stream. We're very happy to talk to you about the best way to get you started in your Graduate Diploma in Nursing. You can study that online, or you can study that in Australia. In Nepal, I can tell you we are, IHM is about to finalise a student support centre in Nepal with a very well-known medical and nursing college in Nepal, which means when you're studying online, you can then go to them on campus for support whilst you are then studying as well. Okay, and that helps a lot of students who haven't done online study before, and it helps bridge that gap that may be there because you've never done online study, so you're a little hesitant. This will help. It'll feel like you're in a classroom all the time. Okay, so we'll have more information on that shortly, but Anna, please do reach out and we can talk to you about Graduate Diploma in Nursing.
Okay, thanks. Moving to next question. It's again from Ramandeep Kaur, and she's writing 7 score in PT. In which course should take admission for getting registration in nursing in next year diploma holder from India in nursing? I guess she wants to ask, she would be getting the diploma completed by the next year, and she's looking for what would be the next option for her.
Okay, so Ramandeep, PTE will be 65. Okay, so there's 2 pieces for you, Ramandeep. The first part is, as a diploma holder, you will need to do graduate diploma in order to be eligible for registration. So your language level for the graduate diploma is 6.5, no less than 6 in any one band. So that's PTE 57 across PTE 57 academic. Okay, that's the first part. That will then mean your diploma will then go from a level 6 to a level 8, and you'll be eligible for registration. If you're graduating next year as a diploma holder, you will need to have 1 year work experience. Okay, so you'll need to do 1 year's work experience in India in order to then, and that's because we need you to have worked for 1 year as a diploma holder, and then you can then go on to the graduate diploma. Okay, so if think about it this way, for all of the diploma holders on this live stream now, this is a really unique opportunity for you to go from a diploma to a master's in Australia. Okay, I don't think there's anywhere else in the world where a diploma holder as a nurse will be able to go from a diploma to master's in 2 years. Okay, IHM is quite unique. We put a lot of value in 2 things. Number one is that you've completed your 3-year diploma. Okay, the second is that you've passed your registration and that you're working as well, because nurses are really smart, and there's a lot of skill every single day in nursing, and we put a lot of value in that in order to meet the entry requirements for the course. So let me just recap for you, Ramandeep. When you finish your GNM course, your diploma next year, you need to work for 1 year in India. Okay, so just get yourself a job and work for 1 year. When you then apply for the graduate diploma in nursing, you will need to have IELTS 6.5, no less than 6 in one band, or PTE 57 academic. Okay, make sure you get the academic bit right. All right, that means then you'll enter the GDN course. Now that will help you meet the eligibility for registration, or for the same language, with the same language level, you can then enter the 2-year master's course. Okay, 1 extra year, 2-year masters, 2 or 3 years stay back in Australia, and you've gone from your diploma to a master's in Australia in 2 years of study. Okay, unique thing with Australia, as the guys at Aussizz will be able to tell you, students work on a student visa. You are able to work 20 hours per week. So it's 20 hours of study, 20 hours of work per week. Okay. And then you hopefully have Saturday and Sunday off. All right. So 20 hours of work. So whilst you're working, we like our students to work in aged care and in disability care, because then you're working in the healthcare system. Okay. The pay is good. The pay is $20 to $23, $24 an hour, and it's consistent. It's not like working at 7-Eleven where you'll be paid $10 an hour. You'll finish your shift at 7 a.m. in the morning and you'll be starting class at 8 a.m. in the morning. Okay. So the pay is good, 20 hours per week. You should be earning $400, $450 per week, which means you can cover your costs, you can cover your rent, have some money to go to the movies, etc. Okay. Maybe send some money to mum, or just put that money in your pocket as well. Okay. So either way, you're able to earn and enjoy your time in Australia, not just have to survive and live a very frugal life as well. Okay. So hopefully, Ramandeep, that's 3 pieces. Hopefully we've answered that for you. If you have more questions, either, do reach out to the guys at Aussizz, because they will be able to break those into steps for you to do. Okay. Good luck in finishing your diploma as well.
Okay, thanks, Simon. Moving to next question. It's from Aswati Asnair and wants to ask, sir, we can also do GCN, which can lead to registration process.
Yes, it can. And very good question, Aswati. So yes, you can do GCN if you're a bachelor qualified nurse or a GNM, either or. You can then go and do GCN. When you apply to AHPRA with your GCN, because GCN is not one of the choices on the drop-down menu. You simply, when you apply to AHPRA, you simply include your GCN certificate, and AHPRA will then review that. And everything that we've seen so far, they are issuing decision letters based on GCN. Okay, so you simply, when you supply your copy of your qualification, submit that to AHPRA along with all your other documents, and then they'll review that and issue a decision letter for you. Okay. So GCN or GDN, either way, Aswati.
Simon, I would like to add one more thing onto her question. So we have to consider GCN and GDN also based on the experience. So there is a recency of practice requirement for the registration. So if there is a gap in experience, then definitely a student, international nurse, should consider doing GDN to compensate the recency of practice or the gap in the experience. If not, students can definitely consider GCN as an option as well.
Yeah, good point, Sinta.
Moving to next question, it's from Minakshi Ghare, and she wants to ask, I have done GNM and post-basic BSc nursing. Can I enroll in graduate diploma?
Sinta, do you want to grab that one?
Yes, definitely there is nothing stopping you from enrolling into postgraduate diploma of nursing. So again, I would like to give you 2 options for this. So if your main intention, Minakshi, is to come to Australia and study, definitely your option will be applying for GDN then master, so that you can come here, you can work part-time, you can simultaneously you can start your process for registration. So that is one option if you are intending for a face-to-face study, or if you want to come down to Australia and start your registration process. If not, being a post-basic nurse, you can start the registration process from India itself. If you're meeting the requirements by AHPRA, you can start the process straight away. So post-basic is more than enough. It's actually AQF level 7 qualification. So it's more than enough for you to start the process from India itself.
Thanks, Sinta. And now moving to next question, it's from Anoop George, and he mentioned, hi, I have secured required English for nurses registration in Australia, but I doubt whether I can pass NCLEX or not. I'm a secondary applicant along with my husband 491 visa, which he may get grant. No further writes, I'm a basic BSc nurse with just a year of experience and a gap of service around 5 years. What are the other ways to secure a registration? Yeah.
All right. So let me start, and then Sinta will finish. And so first of all, there's a couple of pieces to what you've asked there. Okay, you're a BSc nurse with 5 years, but you have not worked for 5 years. Okay, to register in Australia, you need to have 3 months, so not 455 hours of working experience or work in the previous 5 years. Okay, so let's assume that you have not worked. If you study graduate diploma, you're able to, by completing that 1-year course, you're able to then qualify or earn your recency, meet the recency of practice requirements. So the nursing board says because you are studying postgraduate study, graduate diploma, then you are meeting the recency of practice requirements toward registration. Okay. So you don't need to go off and work in India. You can simply come, and I gather you guys are moving to Australia, which is fantastic, on your husband's 491, which is wonderful. You can then enroll in the graduate diploma of nursing. That 1-year course will then help you meet your recency of practice requirements when you then lodge your application with AHPRA. Okay. There are no, unless you have that recency of practice, there are no other ways to secure registration. Okay. The only other way would be for you to work in India for more than 3 months before you come to Australia. Okay. But the easier way, quite often, and this is what we hear, is employers, hospitals don't want to employ someone for just 3 months. They want to employ someone longer, would then be for you to do the graduate diploma in order to then meet that recency. Then you're halfway to your master's. If you guys decide to apply for permanent residency, that master's is worth 5 extra points when you apply for your permanent residency. That's a lot. 5 points is a lot. Nurses, when they apply for permanent residency in Australia, need 65 points. For example, an IT manager needs 90 points. Okay, 95 points, I think now. Okay, very high bar. So nurses, 65 points, 5 points is a lot. Okay, so hopefully that answers your question. The recency of practice can be covered within your course. Do you have anything else you wanted to add there, Sinta?
That's the same, answer I would tell Anup, because she has Anup's wife has a gap of 5 years. Definitely, we recommend her to do GDN in order to, help her with the process for registration. And, OBA would be the best process. There are a lot of apprehensions going around how to, nail the test. But if you do a proper preparation for your NCLEX MCQ, it will be really, you will smoothly clear the exam. So you can enroll or contact OSCE group to enroll for IHM's NCLEX MCQ preparation. That will be your, smooth journey towards cracking NCLEX MCQ.
Okay, thanks. Now moving to next question, it's from Dipanshu Basi, and he writes, how I can practice in Australia after doing BSc nursing in Australia?
So if I understand correctly, you have done BSc nursing in Australia?
Yes.
Okay, if you've done BSc nursing in Australia, you simply need to apply to finalize your registration. Okay, when you finish BSc nursing, the nursing board, the university will advise the nursing board of all the graduated students, okay? And you simply need to contact the nursing board to finalize that registration, and away you go. You don't need to do OBA because you've done your BSc in Australia already, okay? So congratulations. I gather if you've done that, you're either onshore here with Sinta and I at the moment, somewhere in Australia, and it's as simple as you just need to contact AHPRA, AHPRA, the nursing board, in order to finalize your registration. Very simple.
Okay. Before moving to next question, Anup George is again writing that still I should clear NCLEX after graduate diploma for registration, isn't it?
Yes, correct.
Okay, now moving to next question, there's a viewer. Hi, I am GNM nurse, 3 years study, currently in UAE with 15 years experience. What is the best course for me for PR?
Okay. G&M nursery is 15 years experience. Okay. So there's a couple of there's two pieces in here for you. Okay. Number one is G&M nurse. If you're looking to register in Australia, is graduate diploma in nursing. Okay. Takes you from a level 6 to a level 8. You jump over level 7 and then you're eligible for registration in Australia. Now, the other part of your question is in relation to, and I'm a man, I can say this, it's in relation to your age. Okay, you have 15 years working experience in Dubai, which means you're probably, don't take this the wrong way, I'm older than you are, you're probably getting up towards 40, I would imagine, okay, maybe 38 to 40. Because of the permanent residency process in Australia, the older you are, the less points you have, okay? Once you get to around 38 to 40, you start having, basically 40, you have 0 points in your application. The younger you are, if you're 25, you'll get points, 22, you'll get more points, 27, you'll get points, 30, you'll get points. If you're 56 like I am, you get no points at all, okay? So once you're around 40, you'll start to get no points, which means you need to make it up in other ways, which means that if you do a master's, you'll earn 5 additional points. So your if your GDN then becomes a master's, you get 5 points for that, okay? If your language is IELTS 7, you'll get points for having IELTS 7, for example. You've got 15 years working experience in the UAE. You'll get some points, again, for having working experience in Australia, because if you do a master's in Australia, you'll be working as a part-time for 2 years, which is 1 year full-time equivalent, plus you'll have your time in Dubai in order to demonstrate other experience as well, okay? So once you're getting up around 40 in age, you need to start looking at the permanent residency process as much as you do the registration process as well, okay?
Simon, just one more thing, if I can add on top of this, because in our campus, we have, GDN students who have had more than 20, 25 years of experience who came to Australia and did their GDN. So even they have similar, worries whether they will be able to meet the points for permanent residency. But the, best alternative for them to consider, still they have a, hope of light for getting permanent residency in Australia. They can, after GDN, they can do their registration with AHPRA. And also while they are in Australia, they have, if let's assume if they're coming here to study, they will be eligible for, if they do master, they will be eligible for 3 years stay back. So that 3 years is more than enough for a registered nurse to get a job sponsorship. So that's also an alternate pathway for them to get permanent residency in Australia. So you have opportunities in Australia. If not, you're directly applying for permanent residency.
And just building on to what Sinta just said, which is a really good point. If you then look at regional areas, so areas that are outside Melbourne, outside the major cities, or in Perth, for example, that then they're much more favorable visas. They're very happy to sponsor workers in those regional areas. So there's lots of different pathways. It's not just one pathway. There's lots of different visas based on employer sponsorship, and employer sponsorship in regional areas, for example, and they often ask you to say, look at a 3-year or 5-year contract. That's a great way to be able to get into, become registered, study, become registered, and then settle in Australia with, really in a great lifestyle as well.
Yeah. Another add-on point for her, I would say, because she has 20 years of experience and she is very keen to migrate to Australia. We have our November intake for GDN. It would be good for her to enroll for the earliest intake so that she can start with the registration process to Australia as quick as possible. So November intake will be one suggestion from our end for you to consider for a GDN.
Moving to next question, it's from Twinkle Bassi. I am 12. Can I do nursing in India and then I practice in Australia, or is it better to do it in Australia only? After doing nursing in India, how I can practice it in Australia? I guess she is asking, she has done year 12 and she is further asking for the options.
Okay, thanks, Twinkle. I kind of hoped you'd done year 12. You weren't 12 asking the question. So look, you have a couple of options. Look, if you study in Australia, either Diploma of Nursing, which is then for an enrolled nurse, or Bachelor of Nursing, which is for a registered nurse, they lead, both of those courses in Australia lead directly to registration. So if you're a 10+2 student, okay, and you're looking to come and study nursing in Australia, you can do a 2-year diploma, which will lead to registration as an enrolled nurse, or you can do a 3-year bachelor, which will then lead to registration as a registered nurse. Those are your two best options, okay? Direct to registration on campus in Australia, working 20 hours per week for 2 years or 3 years, life will be great.
Okay, thanks, Simon. Now, moving to next question from Ashwin. I might have missed few things ahead of the video session, so apologies for any repetition. If you have done 3 years of PCL nursing done from Nepal, which equals to diploma in Nepal, and have got 1.5 years of work experience, can you enroll in graduate diploma and enroll in masters in nursing? And how long would the course be to be a registered nurse in Australia? What would be the process, also keeping migration to Australia in mind? And also, what would be the difference in doing bachelor's and master's?
Okay. There's 7 pieces to this question. Oh, you've taken the question down. Now I won't remember them all. Look, the key challenge you have at the moment, Achille, is the mapping or the level of a PCL, so your 3-year PCL nursing program in Nepal, to a relevant Australian level, okay? And as it happens, I've asked today I asked one of my team to do that mapping for us so we can confirm where the entry point for you is, okay? So your question is probably one day ahead of us having an answer for you, but we'll happily come back to you over the next couple of days, all right? So 1.5 years work experience, fantastic. So you can tick that box, that's good. We do need to confirm where a 3-year PCL diploma will fit into the Australian framework, okay? That'll then tell us whether you can do GDN or whether you need to do some makeup units in order to then reach what might be the equivalent of a 3-year diploma from India as well, or whether you might need to do the diploma of nursing in Australia, and then you can then go on to a bachelor. Okay, so there's a couple of questions in there. Can you enroll in graduate diploma? I will be able to answer that once we know where you fit in. Okay, the same goes with masters. Okay, excuse me. All of your other questions really we'll have the answers once we know where a PCL course fits in against a relevant Australian course. What we'll then do is we'll come back to you to say you either need to do this course or these extra makeup units, or you have another option, okay? And we'll come back to you in that. We have your contacts there, I think, so we'll come back to you in the next day or two once we've had our Director of Studies map all that out for you, okay? But do rest assured, we'd love to see you in Australia.
Okay, thanks, Raymond. So again, Anoop George is writing, hi, just one more doubt. If I do a MSc Nursing at Australia, I will directly get registration or not? I can secure MSc Nursing admission with my current IELTS score of 7, isn't it? With gap 5 year.
Okay, Anoop, let's go back a step. So let me answer the last part first, and then I'll answer the first part last, okay? So with your MSc Nursing, if you have a 5-year gap, you have 2 choices, 2 very simple choices. First choice is you need to go back to work for 450 hours, which is 3 months, before you can apply for registration, okay? That's choice number 1. Second choice is you can enroll into the graduate diploma in nursing, which will then, over 1 year's study, be seen as the equivalent of the 3 months, 455 hours of work, okay? So they're the 2 choices there. With an MSc Nursing, hang on, let me go back a step. So once you've got that recency of practice, either 3 months working in India or you've done your GDN, then you'll be able to apply for registration. Your master, if you do the go on from GDN to do the Master of Nursing, it does not lead directly to registration. You still must do the OBA process, okay? So let me just repeat that. Even if you do the MSc, it does not lead directly to registration. So what you would be doing, what you would do is this. If you did not want to work in India again, you can come and start, for example, in November of this year, November 2021, you can start enrolled into your graduate diploma in nursing, okay? You can start that course online, and that still counts to, if you do a master's, that still counts towards your post-study work visa, okay? When the Australian borders open the middle of next year, you then come to Australia and you join us on campus, okay? By the time you finished your GDN, you then apply to the nursing board for registration, okay? Whilst your application is being processed, you then go on to finish your master's for 1 more year. By the time you finish your master's, your registration will be finalized because you will have applied to AHPRA and then done your OBA. You'll finish your master's, and then you will be able to, you'll have a 2-year or a 3-year post-study work visa where you can go straight into work, okay? So to me, they're the steps you probably need to go through. Unless you have a job or you want to go back to work, I would get started on GDN in Australia, okay? Meet your eligibility, finalize your registration, finish your master's, 3 years working in Australia, and during that time, you might decide to apply for permanent residency as well, okay? So just do be careful. IELTS 7, you need IELTS 7 to get registration. You need IELTS 6.5, no less than 6 in any one band to get into eligible for GDN, okay? Whilst you're studying GDN, your English will improve because you're studying and living and working in Australia. You'll be working part-time. You'll be studying with us 20 hours per week. You'll be speaking in English everywhere you go, almost everywhere you go, okay? And your English will improve from 6.5 to 7. You'll take your test. You'll apply to just before you lodge your application for registration with AHPRA, okay? Job's done. So Anup, I think it's all organized. I know, Sinta and I know exactly what you need to do in order for you to realize your dream of being able to live and work in Australia.
Yeah, basically, as Simon said, there are a lot of different options. So we have to actually choose that option which would suit our circumstances and our background, but the options are different. So you can choose it.
I mean, one thing you probably should be, and the team at Aussizz could help you with this, Anup, as well. There are lots of offers of wonderful solutions, okay? Study with us, never come to campus, turn up on day 1, come back on the last day, we'll give you your certificate, okay? Does an employer know that college? No. Does that help you get a job? No. Does it help you get registration? No. Okay, so you've got part of the work and the help that Aussizz and Sinta and her team is to sort out what is true and what is not true. Everything we're telling you today is exactly the truth, okay? So that's really important there because there are a lot of offers of all sorts of wonderful solutions that end up in tears, unfortunately. And we see students coming to us saying, I've just done 6 months of this course and this hasn't happened and that hasn't happened and all these other things haven't happened. How can you help me? Okay. So talk to Aussizz, talk to Sinta, and they will be able to map out a path so that you will end up realizing your dreams.
Thanks, Simon. I hope, Anup, you have got your answer. And if you still have any doubts, you can contact us and one of our experts will get back to you for further details and all the consultations you require. Thanks. Moving to next question from Arzu Gupta. I have completed nursing in India. How can I practice in Australia?
Sinta, do you want to grab that one?
Yeah, the question is, I'm not sure what level of nursing study in India.
Over to
Yeah,
you.
so I think we have already replied to this question. Previously, we have answered this question. However, it would totally depend on your qualification, as Simon previously mentioned. So depending on whether you are a GNM nurse or you are a bachelor's qualified nurse, if you are a 3-year diploma holder, probably your next best option is to do a GDN with IHM. You can do it online or face-to-face. Our next intakes are in November, and after that we have in March and July. If you want to immediately get started with your nursing registration, we would recommend you to contact OSCE Group for your enrollment for GCN or GDN course. And then if you are a bachelor's holder, still you can contact OSCE Group and start your registration process with AHPRA. So 2 options, and also you have to consider your IELTS score as well as your experience before you can get started with the registration process.
Yeah. Good luck.
Okay, so we have covered all the questions so far. So before concluding the session, so do you want to add something, Sinta and Simon?
No, I think we've hopefully through all of the questions we've given you the right information. As I said, if you do have any questions, talk to the guys at Aussizz. Talk to the Sinta and Aussizz work very closely together. One thing I will say, if I may, just for a moment, Naman, is that IHM works with a small number of agents. So we work with probably if I look at India, we probably work with 7 to 10 good agents who we work with every day. Aussizz is one of those agents. So we trust them. We trust them to give you the right advice. We trust them to ask us if they have a question. And so then we know that when you come to join us in Melbourne, Sydney or Perth, you'll be coming with the right information and you'll be working towards realizing your dream of living and working in Australia. So thanks to Aussizz for making this opportunity available today to talk to you as well via Facebook. And yeah, if you have any questions, just contact Aussizz and they'll be more than happy to give you the right information and get you started on your journey.
Right, thanks, Naman. That's all from our end.
Thanks again, Simon and Sinta. It was a really valuable session for all our clients because we have been receiving number of inquiries relating to nursing. So thanks once again for giving us your valuable time. And at the end, so any of our clients, if they're looking to make their career in the field of nursing or who already have their nursing qualification and they are looking to get the registration in Australia, they can contact us. We have put all our details in the Dropbox. You can send email or you can send us your contact number. One of our experts will get back to you to have a consultation with you. Thank you so much.
Good
luck.